I'm Scott Loughlin. This is the Data Chronicles, and here are your data points. On today's episode, we are continuing the discussion of new U.S. state laws relating to health privacy. On a prior episode, we covered two types of new laws: general privacy laws that uniquely address sensitive data, and then a second type, new health-focused privacy laws that uniquely apply to health. Lots of great information in that episode, so if you missed it, check it out. But today we're actually going to discuss a third type of law that has recently been enacted in several states, those that are relating specifically to geofencing. Especially in the post-Dobbs era, there has been concern that organizations may be able to collect information off of people's smartphones about who is visiting a medical facility. For example, if a phone is collecting GPS information, then third parties with access to that information may be able to know the phone's whereabouts. If that phone or the person who was carrying that phone visited a hospital or a clinic, then they may be able to gather some information. Some of those facilities are targeted to specific healthcare conditions like cancer or reproductive health, which allows the third parties to make inferences regarding potential health conditions that those individuals have. This type of practice got a lot of attention amongst federal and state legislators, and several states banned the practice, but they did so in a rather expansive way that may result in potential application of these laws to a wide variety of entities who are far afield from traditional healthcare organizations. To discuss these laws, I've invited Paige Papandrea, an associate in our New York office, who focuses her practice on health privacy. Paige, welcome back to the podcast.
Hi, Scott. Thanks for having me.
So, Paige, maybe you can get us started by giving us an overview of where we're seeing these laws pop up and generally what they require.
Sure, Scott. So following the Dobbs decision, several states reacted by passing various reproductive and health privacy laws. Some states took a very fulsome approach, like Washington, which enacted the My Health, My Data Act, which includes its own geofencing prohibitions, and other states like California, Connecticut, and New York reacted more narrowly, passing, amongst other reproductive health bills, laws prohibiting geofencing around certain healthcare facilities. Similarly to Washington, Nevada reacted rather broadly, enacting a My Health, My Data Act equivalent law that also includes geofencing prohibitions. These geofencing restrictions apply very broadly to all people and all entities. They are not limited to regulated entities or businesses as may be defined by other privacy laws. What this means is you don't need to otherwise be subject to a state's privacy law, whether that be the CCPA or the Washington My Health, My Data Act, to be prohibited from geofencing under these laws. The scope and the range of how broad the geofence is varies in each law, but generally goes from about 1,700 feet to 2,000 feet around specific healthcare facilities. In California, this is limited to family planning centers. In other states, it's limited more broadly to any place that may provide healthcare services.
So, that's really interesting, but maybe for background, how does the geofence work? When we're talking about proximity to a specific healthcare facility, what does it mean to create a geofence around that facility?
Sure. So geofencing generally involves using technology like GPS coordinates, cell tower connectivity, cellular data, a Wi-Fi network to form a spatial or location detection boundary around a specific physical location. So if you have an in-person business that offers Wi-Fi and that Wi-Fi only extends, let's say, 2,000 feet around the router, that may be establishing a geofence of sorts. And if you offer healthcare services at that business, you might be prohibited from using that Wi-Fi network to collect information about the people who are visiting your facility.
So in other words, this is a type of technology that will allow third parties or publishers of applications or so on to be able to know whether you are physically close to a healthcare facility or any other facility that has a geofence around it.
Correct. And we've already seen certain mobile applications use this in other practices. You may have opened a retailer's mobile application to do a check-in to pick up an order, or it may have automatically detected when you pulled into the parking lot. So we've seen this across other mobile applications used more broadly, usually for ease of convenience for retailers and other consumer services. But there is a potentially dark underside to these practices when the collection of that location information can be used to infer certain health characteristics about people.
And that was probably the reason why this particular practice got specific attention post-Dobbs. What was the concern that was driving the post-Dobbs related considerations?
Sure. So following Dobbs and the restrictions on reproductive health care that followed, legislators in these states were concerned about third parties being able to track those who may have been getting reproductive health care services, specifically abortions and people who are going to certain family planning centers. Given that third parties who hold data about us aren't always required to have a warrant to hand over certain data, including location data, these states wanted to outright prohibit the collection and use of geofencing technology to target those around healthcare facilities to kind of cut the information off at the source.
So, in other words, if there was an organization who was collecting geofence information around a family planning center, concern was from the legislator's point of view is then they would know who were expected mothers who may have had an abortion and then provide that to law enforcement in a state or jurisdiction where abortion is illegal. Correct. And thus those individuals could be criminally prosecuted. So then as a result, we see these handful of states start to legislate around that particular activity to prohibit the geofence around those locations, such that organizations, any really third party or a publisher of an app, cannot add a geofence around those locations for purposes of identifying whether an individual has come or gone from that facility.
That's right, Scott.
Interesting. But it also sounds like from what you were saying a moment ago, is that the laws themselves were not restricted or limited only to family planning centers or reproductive care centers or cancer hospitals. In fact, they apply much more broadly.
That's right. So California has the narrowest scope in terms of what locations it applies to. California outright prohibits the collection, use, disclosure, or retention of information collected via a geofence from anywhere near a family planning center. That's very narrowly defined, typically to include facilities that provide reproductive health care services. Connecticut limits it somewhat similarly to reproductive or sexual health care facilities, as well as mental health facilities, which expands the scope quite a bit. And then we have Nevada, New York, and Washington that more broadly apply to medical or healthcare facilities.
And it sounds like it's not the entities who are subject to these laws, similar to the conversation we were having in a prior episode, that these laws apply much more broadly than traditional healthcare organizations, plans, payers, healthcare providers. They apply to, I think you just said, any person.
Correct. So for example, a retailer who may have had a mobile application that allowed for virtual check-in for order pickup, particularly ones that automatically detected users when they arrived at a physical location, may need to reevaluate their practices, given that certain consumers may be purchasing healthcare-related products or going for healthcare-related services. And these laws, particularly Washington and Nevada, are incredibly broad and will pick up those types of activities.
And if I'm reading these correctly, while we're always thinking about them as geofencing type of restrictions, they could potentially have implications for any location-based data associated with a healthcare clinic. So if I'm thinking of an example, say that I'm visiting somebody in the hospital, but I don't want to eat hospital food at the cafeteria. And so I pull up my favorite food delivery service and have them deliver food to me at the hospital. That could be associated now as being information relating to the fact that I'm at a healthcare facility that's triggered these laws? Is it that broad?
In certain states like California, it will be because of that broad prohibition on the collection and use of the information. States like Nevada, New York, Washington generally require the information to be used to identify or track consumers that are seeking healthcare services, otherwise collecting consumer health data. So maybe an inference that you are the one who is in the hospital receiving medical care, or to send notifications, messages, or advertisements to consumers related to consumer health data or healthcare services or products.
Right. But it seems like it can get quite broad quickly. Like if I take a taxi cab to an ER because I'm feeling ill, now the information, the fact that I'm going to that particular facility to seek care could trigger some of these expansive notions of what constitutes health information.
Yes, it will get very tricky, particularly for businesses that rely on a lot of location-based services to provide their intended product or service to a customer. So it's very important to look at the different states' laws that may apply to you and talk with outside or inside legal counsel on how they may work.
Paige, really appreciate this update. I think this conversation, in combination with the one that we did our prior episode relating to general health privacy laws that are merging at the state level, really informative to understand the landscape of health privacy in the United States. So thanks so much for joining us. With that, I'm Scott Loughlin. This is the Data Chronicles, and those are your data points.